Now just over a week on from a Whatu Order Health New Zealand letter to staff telling them not to cover sick staff, to ban double shifts, close some vacant roles and make staff take their annual leave, all in a bid to save money. The controversial document stated that public hospitals have been tasked with saving a total of $105 million by July. So are staff at our hospitals following this advice? Are they even able to and still function properly? Or is this going to have an impact on patient care and push wait times even further out? The CEO of Health New Zealand, Margie Arper, joins us this morning, and thank you very much for being with us. Good morning.
Good morning.
Margie, just since that letter was issued to staff, I just have two quick questions for you. First of all, have any vacant roles been completely closed now?
We are still recruiting, so just to be clear, and they were not instructions to staff. They were advice to leaders and managers to encourage them to look at where they have actually, we have seen an increase in staffing over the last few months, which is quite a contrast to where we were a year ago. That's given that we've got new staff, we've got over 2,500 nurses that we recruited to date, that we need to we've asked leaders to go back and look at whether some of the things or the costs that we would have had because we had to fill those workforce shortages, check whether they are really needed now, particularly things like overtime. We have got staffing. We do set budgets assuming a level of annual leave and sick leave, so making sure that staff are taking their annual leave where they have the resources to do that. So that was guidance to leaders and managers, and we are still recruiting. In the last week, we have approved over 300 additional staff, and we are particularly concerned in areas where we still have shortages, like ED, mental health, critical units.
Yeah, so those are some pretty key areas where there are shortages. So just those two quick questions again. Have there been vacant roles that are now completely closed? You're saying we're not going to recruit in that area anymore. In the past week, have you closed them?
We are testing whether roles that are not in budget or aren't replacing core services, the roles that don't fit those criteria, we are going back to managers to check whether they really need them.
Have staff been sick and they haven't been covered in the past week? Has that been something that has happened?
I don't know that, but I know that managers are taking a good look at where they do have services that are staffed up, that if they need sick leave, and again, it's dependent, which is why we need trust our leaders and managers to make some of those decisions based on the day, how the ward or the service is operating on that day, and make those judgments carefully.
Because we've got some feedback here, if I can read to you, from a nurse who says, in terms of being staffed up, there are no departments staffed up, and she says if they do not cover sick leave, some wards would have maybe one or two nurses covering a whole ward with up to 35 beds on a ward that would normally have 6 to 7 nurses on a morning shift and 3 to 4 at night. You can see how we need agency nurses to cover these gaps. She says it's impacting health and outcomes of patients, as well as wait times. If these cuts are implemented, it will make these issues so much worse. They really need to look at patient care and health outcomes rather than a budget book. This is coming from a nurse who is working in those departments saying there are no areas that are staffed up.
Well, we have recruited over 2,000 nurses than what we have budgeted for. And across all hospitals, we have increased staffing. If she's writing, and I don't have the specifics, because we know that there are some services, as I have said, that we need to keep pushing on to recruit. And we've invested in international recruitment programs targeting those areas for both nurses and doctors. And so if she's working in an area where there are shortages, it's really important that those leaders are making judgments about ensuring that they are able to provide safe staffing.
How much is being spent on paying consultants PwC to oversee cuts? How much is being spent on that?
PwC are not overseeing our cuts. We have a couple of districts where we need to second in some finance staff to cover some vacancies, and Christchurch being one of those areas.
And how
these are big budgets, and we need the skills. So while we're recruiting to fill those vacancies, I don't have that information in front of me.
You don't know what you're paying consultants there?
We're not paying consultants.
The fact that you're running a ruler over the rest of the budget?
On your specific question, I don't have the answer to that.
Okay. What word would you use to describe the quality of patient care at the moment?
We are delivering more care than we have in the previous calendar year, more surgeries. We're seeing 10% more people in ED departments. Our whole primary care sector is seeing more people. So we are actually providing more care. This situation we're in is really about trying to get back to a budget where we can't go into deficits like the previous DHBs were able to in this financial year, and ensure that we are able to preserve ongoing investment in prevention and primary care and community. But certainly within hospitals, we have continued to deliver more, and we have put more funding into hospitals in this financial year.
Do you think people should have private medical insurance?
That's a call for individuals. That's not a comment I can make comment on.
Do you have private medical insurance?
No, I don't.
The doctors' strike that is planned at this stage for the 7th and 8th of May, 25 hours, can you guarantee that patient care will not be compromised over that time?
As we do with any strike, we are working with the unions to ensure that we have life-preserving services in place over those strike, and we are hoping that we can get back to the table to continue negotiating on an arrangement that can support safe staffing.
CEO of Health New Zealand, Margie Upper, appreciate your time this morning. Thanks for being with us. It's 12 minutes past 7, and there is also a statement from Te Whatu Ora Health New Zealand on that junior doctors' strike. They say that further discussions are scheduled with the union this week. We've already indicated we're prepared to make a very significant investment in settling the NZRDA collective agreement, and we have guaranteed no RMO will receive a pay cut. Doctors will still be available during any strike action to provide life-preserving services.